Good afternoon. My name is Steve Bloom. I'm president of the board of directors of the CLL Society, and I would like to welcome you to our continuing coverage of ASH 2021, key abstracts and posters. And we are honored today to have Dr. Alexey Danilov from the City of Hope Medical Center join us for a few minutes to discuss a very important abstract that he was involved in at ASH. So I'm going to ask Dr. Danilov to introduce himself, and then we can get right into the data read.
Thank you so much, Steve, for having me over here. And my name is Alexey Danilov. I'm professor of hematology and stem cell transplant at City of Hope, and I also lead the lymphoma center at City of Hope. My clinic is mostly focused on chronic lymphocytic leukemia patients.
Great, thank you. So moving right along, I'm going to go right to Saturday, December 11th at ASH in Atlanta, Georgia. You and your colleagues from the City of Hope presented some data on the topic of Richter's transformation after CD19 CAR T cells for relapse refractory chronic lymphocytic leukemia. And as we know, Dr. Danilov, 5 to 10% of patients with chronic lymphocytic lymphoma will develop a more severe or aggressive form of Richter's transformation. And unfortunately, there's a median survival here of less than a year. I was wondering if you could maybe take a few minutes and discuss the significance of this data, what it means for patients with CLL, diagnosed with CLL, and then I'll have a couple of follow-up questions.
Yeah, thank you, Steve. So Richter's transformation is certainly an unfortunate event in CLL. Typically, there are certain risk factors which predispose to Richter's, such as prior chemotherapy, certain genetic abnormalities, and unfortunately, often we do not have very good options to treat this disease. It often is refractory to chemotherapy that we use for lymphomas. And also there are not necessarily a whole slew of novel agents for this particular disease. So this is always something to keep in mind when we see patients with rapidly progressive CLL. And what we presented is some data from City of Hope looking at patients who received CAR T cells for CLL. And essentially, what this data means is that some of the patients may escape CAR T cell therapy, become resistant to CAR T cell therapy by developing Richter's transformation and ultimately succumbing to the disease. Of course, we also have now data that CAR T cell therapy itself may be effective in patients with Richter's transformation sometimes. So this is really a paradox. We can see that Richter's transformation can occur in patients who receive CAR T cells for CLL, and that would be the mode of progression, but also some patients with Richter's can receive CAR T cells as well. So this will require further study. Who exactly would benefit from CAR T cells, who would be at a particular risk of this complication, and who would benefit most.
Okay, thanks for that overview. So one of the questions I had, and maybe you can expand on this, I noticed that 5 and 7 of the patients that seemed to transform to Richter's had del-17p. Is there a correlation there? Is that part of what you were talking about relative to the genetic risk factors? Can you talk about that and maybe some other thoughts that you have?
Yeah, so exactly. So patients who have deletion 17p are at high risk of Richter's transformation. So a priori. So what we don't know from the study, of course, is whether Richter's transformation was already present at the time that CAR T cells were infused. So I strongly doubt, I don't think that CAR T cells actually caused Richter's transformation. It's just, unfortunately, sort of natural evolution of the disease. So, but certainly deletion 17p does predispose to Richter's transformation. And that's one area where we have to be particularly careful. These patients should not receive chemoimmunotherapy. because like fludarabine, bendamustine, because it only makes things worse and increases the chance of Richter's. So we also always should test for FISH abnormalities before starting any sort of treatment. I want to mention also that we presented another poster where we have where we're exploring alternative therapeutic options in Richter's, as options are so few. So we presented a study of a combination of PI3K inhibitor copanlisib and PD-1 inhibitor nivolumab, where basically we are co-opting the patient's own immune system to attack Richter's cells. So, and we have some promising results on the study with responses in several patients, but the study is ongoing, and hopefully at next ASH we will be able to present more data.
Okay, great. And then just one last question. Again, it's back to this risk features versus no risk features. So is there, seems to be a collection of risk features that might contribute to this transformation. Is there more work being done to understand, you know, the sort of the effect that all these different risk features have on your ability or your predisposition to developing Richter's transformation?
Yes, for sure. There is some work being done. In addition to p53, the regulation of MYC oncogene pathway, MYC, it's one of the common oncogenes which causes cancer. So the regulation of MYC pathway has been implicated in Richter's transformation as well. In fact, a group at City of Hope, Lily Wang's group at City of Hope, has developed new models of Richter's transformation, which feature some of this, and they presented their work at this ASH as well. So we now have Richter's models where we can study new therapies. That's the implication of that. So yes, indeed, some very interesting work is ongoing on the subject, including at City of Hope.
Okay. Well, great. Those were my questions. Any last comments or takeaways for the audience, knowing that we're presenting this data to patients with diagnosed with CLL or caregivers or other interested parties?
Yeah, I would say that Richter's transformation is a rare condition, and I would strongly advise patients to seek second opinions if they're diagnosed with Richter's transformation. It is a disease very difficult to treat. However, we have a lot of emerging options, and we strongly encourage patients to consider clinical trials which present those novel options. So I would advise to always seek a second opinion regarding management of Richter's.
Okay, thank you, Dr. Danilov, and we appreciate you taking time out of your schedule, and appreciate you continuing to update patients and interested parties on the great data coming out of ASH 2021. Have a good afternoon and a good weekend.
Thank you.